Hi, everybody. My name's Dr. Alexandra Smith, and I'm a naturopathic doctor here at Nirvana Naturopathic Medicine. My primary practice focus is on women's health, so lots of hormones and gut health, which kind of ties into our topic today, which I'll introduce once Dr. Morrison has had a chance to introduce herself.
And I'm Dr. Morrison, and I am also a naturopath here at Nirvana. My practice actually focuses a lot on nervous system regulation. I work a lot with chronic inflammation and digestion. So the neurofeedback treatment that we offer here as well that focuses on the nervous system is a big part of my practice, which we will also get into today a little bit more in depth.
Lots of stuff that we're diving into. So to start, we're going to kind of explore how stress, brain function, and gut health are deeply interconnected. And then we'll go into some nervous system regulation tips at the end here. So without further ado, first question I have on the docket.
Yeah, I'll just say something. As we go through the chat, you guys can put your questions in the box at the bottom too, and we'll get to those at the end or through if that is more appropriate. But yeah, just pop them in there and we'll check them at the end.
Yes, totally. We'll make sure that we give 15 minutes at the end of the chat so that we can answer any questions if there are some. Dr. Morrison, why don't we first start by talking about just what is the nervous system?
Yeah. So yeah, whenever we're talking about the nervous system, of course, there's like a bunch of different types of nervous system that are in there. I think with these topics, we focus mostly on the parasympathetic and sympathetic sides of the nervous system, but really the nervous system can be broken down into two different parts. So we do have like our brain and our spinal cord, which is going to be part of the central nervous system, and then all of our peripheral nerves that come off of that part of that peripheral nervous system, or the PNS. Then that PNS is going to be broken down into two further parts, one being the autonomic nervous system, and then that is then going to be broken down into that parasympathetic and sympathetic. And so when we talk about those two things, kind of the classic example that people use, that parasympathetic side is that rest and digest, if you guys have heard that term before, and then that sympathetic is going to be more of that fight or flight. And kind of that classic analogy between those is like kind of the zebra and the lion. So if you're a zebra and you're just hanging out eating, you're going to be in that rest and digest. And then when that lion comes to chase you, you're up and you're running away, or you're going to fight that lion, and that's when we go into that fight or flight. And really, when we go between those two types of nervous systems, it's going to control a lot of blood flow, which is going to be really important for the digestive piece of this. And so again, when you're in rest and digest, you can think of that blood flow is going all to your internal organs. So when we think about digestion, we're breaking down our food, the blood flow is going there, our enzymes are going to be released, our stomach acid is going to be released, and we can digest all of our food appropriately like that. Also with that, you're going to notice like a slowing in heart rate, a slowing in breathing rate. Again, we don't need a lot of oxygen in that state. And then when we go into the fight or flight, you can think of all of that blood flow going to our extremities, our arms and our legs in order to run and fight. And so the blood is going to be taken away from our internal organs, away from that digestion. And so it's actually going to really impact what state that we're in when it comes to digestive health or mental health when we're stuck in, let's say, fight or flight, more in rest and digest. Ideally, we live a lot of time in rest and digest, and we drop into fight or flight when we need to. When we're done with that fight or flight response, we go back into rest and digest. But what we typically see with a lot of chronic health issues, whether it be hormones, digestion, mental health, is that we get stuck in that fight or flight nervous system state. And then we can have really big issues with digestion or recovery or sleep, because like our blood flow isn't actually where we need it to be for those things to happen or for recovery to happen. And so we really focus on that nervous system training and trying to shift back into that rest and digest or that parasympathetic state. One of the things with kind of like the third layer to this, more of like that dorsal vagal response or something called faint or freeze, if you guys have heard of that, it sometimes is lumped together with that fight or flight fight or freeze, but it is actually kind of like a third branch to this. And so if you're living more in that fight or flight all of the time, and then something else comes in and kind of overwhelms the nervous system, then we can drop into that faint or freeze state. Mm-hmm. And that's kind of that overwhelm. Again, this is kind of like that subconscious side of things. So we can feel overwhelmed and not be stuck in that faint or freeze, but it's what kind of that's when our tendency to go towards that. Mm-hmm. And then we actually have to come back through fight or flight in order to get into rest and digest, which can be very uncomfortable for the system as well. And so that's kind of how, when we look at or assessing the nervous system, looking between those three areas of where our system is used to living and used to being kind of stuck there, and how we can shift it from one state to the next to try and get it back to that rested digest in order to heal, support mental health, hormones, digestion.
Totally. Yeah. And yeah, I mean, a key way that we can actually assess these things is by looking at heart rate variability, right? Which is something that we are able to assess here at Nirvana within our neuroanalysis, where we essentially have patients sit for 1 minute and breathe following the trajectory of a ball, where they're meant to be breathing in when the ball goes up, and down or out when the ball goes down. And that regulation of the breath should provide a big change in that heart rate variability, right? And if your heart rate is very variable, meaning that it goes up a lot when you breathe in and down a lot when you breathe out, that we would call a variable heart rate. That indicates more of a parasympathetic nervous system dominance. You're sitting more in that rest and digest all the time. If your heart rate is being really tightly controlled, it doesn't shift a lot within that 1 minute variability. That tight control is more of a sympathetic nervous system response, meaning that your body is sitting more in that fight or flight state. We're ready to run from that bear or from that lion at any point, right? So this is something we can assess for, and then we can work on by working with training around heart rate variability.
Yeah.
We can also pick up dorsal vagal responses within a 5 minute heart rate variability assessment. And that's where we can really see, okay, is the nervous system getting into that overwhelmed state? Again, like Dr. Morrison mentioned, this can be subconscious. It might not be something that you actually feel is happening, but we'll pick it up on heart rate variability assessment. Yeah. What are some things we can do to help our bodies kind of move into that parasympathetic nervous system?
Yeah, perfect. I was just going to speak to that. So that's great. So yeah, talking about the heart rate variability, breathing practices actually, and practicing deep breathing can be very helpful. And so again, there's 1,000,001 different breathing practices out there, but as long as you're focusing on actually the exhale. So when we inhale, we're taking oxygen in. You can think of that again, we need that oxygen to run. So that's going to stimulate the sympathetic. So maybe a shorter count for that sympathetic, let's say 4 counts in. And then as we're exhaling that parasympathetic, we're getting rid of that oxygen, potentially 8 counts out. Usually, as long as that parasympathetic or the exhale is going to be longer than the inhale, that can help to shift your nervous system back into that parasympathetic state. So breathing, especially if you have that flexibility and that heart rate variability and the ups and downs, can be a really powerful tool for people to help shift that. Breathing potentially might not be so helpful when you don't have that flexibility, or if that line is more straight across and it actually isn't shifting you back into that rest and digest state. So then we do want to use other techniques or treatments. It's kind of the same as like meditation. Sometimes meditation really works for people, and sometimes meditation causes more anxiety. So then that might not be the first thing that you go to with that. But for other, like if breathing isn't part of it, or other things that we can do to help with that, basically with that parasympathetic side of things, we're really focusing on the vagus nerve. That's going to be actually the nerve from that side of the nervous system that's going to help to trigger parasympathetic. So anything that helps to strengthen the vagus nerve or treat it. So kind of from like basic things that you can do at home, any type of like singing or gargling or humming can actually strengthen that vagus nerve. There's like hot therapy and cold therapy that you can do to help to like balance that blood flow and nervous system state as well. So those are other things that you can do in your daily practice to help strengthen that vagal tone or that parasympathetic state with that. Of course, with this too, if we are stuck in that fight or flight, and here at Nirvana, we do offer a lot of neurofeedback training to help train the system. And what we can see in the brain too is kind of the reasons why people are stuck in that fight or flight. And so really with neurofeedback that say like, if your cup is full with water, all of these things, infection, inflammation, hormone imbalances, stress, poor sleep, all of these things that are filling up your cup. And every time something comes in, it's going to overflow. Really what we want to do with neurofeedback is like make your cup bigger so that we have more space within that nervous system, or take things out of your cup. So again, we're creating more space, reducing the noise that's in there. So you actually have the ability and flexibility to drop into parasympathetic state. Your body and your nervous system feels safe in order to do that. And a lot of the times we see with that fight or flight, again, there's typically a reason that we're stuck there. It's not just happening. It's okay. There's actually part of our brain called the limbic brain that is there for survival. That's all it cares about. And so if there's anything that has been an overwhelm to your nervous system, it will remember that memory to try and predict the future to make sure that that overwhelm doesn't happen, or that we are still in that survival, like we're still surviving. But what can happen is when it's like there's all this information coming in, it triggering those memories, it actually can become like overreactive. And so it can perceive things in the external environment or internal environment as a threat, but they're not actually that threat. So what we want to do is help to actually train, incorporate that information, process that memory, allow the nervous system again to feel that rest and digest instead of being stuck into fight or flight. And one of the things with that nervous system in fight or flight too is it really likes things that are predictable and familiar. So one of the reasons it can be hard and actually really uncomfortable to be in rest and digest, and one of the things I always joke about is when we're used to being in fight or flight, you know, we go down after work and we sit down and we're like, okay, it's my time to rest. But then in your head, you're making your list for the groceries, or what you need to do tomorrow, or what workout you're going to do, or what your summer plans are for next year. Like all of these things can come flooding into our brain, and what we're trying like make plans for all of these other things. But that's actually your nervous system pulling you out of that rest and digest. It's like, no, we don't like this, so we're going to actually create more plans. We're going to pull us back into fight or flight because this is what's more familiar and predictable. And so it'll keep you stuck in that state because that's what it knows. And our nervous system will always choose what it knows over the unknown until we kind of force that threshold and push ourselves out of that and make sure that we're feeling more comfortable with that discomfort. And so helping that nervous system to process those memories, kind of unlink those, actually allow it to feel safe back in that rest and digest, because it's not just as easy as just rest. To get you there can be very helpful for that from a neurofeedback perspective.
We've touched a little bit on the vagus nerve. We know the vagus nerve and digestion come up a lot. Why don't we dive into how the vagus nerve affects digestion? We've talked a little bit about blood flow, right? Where if you don't have blood flow going to your digestive system, we're not going to break down our foods appropriately. We're not going to secrete the digestive enzymes and stomach acid and bile that are necessary to break down proteins, carbohydrates, fats, right? But there's also a key piece of that vagus nerve stimulation. So why don't we touch on a little bit about that?
Perfect. Yeah. One of the biggest things, other than all of the digestive kind of functions there, is something called the migrating motor complex that vagus nerve is going to be a big part of. And so the migrating motor complex is actually also known as like peristalsis, but it's a wave-like action that's going to sweep everything north to south through your digestive system. So, you know, once we eat, stomach, small intestine, large intestine, until we have a bowel movement. And so about 90 minutes after we have our meal, 90 minutes later, we're going to have that wave-like action sweep through our system. And so if we are in more of a stressed state, if we're not having a lot of time in between meals, then actually that wave-like action doesn't occur as effectively as it should. And so that can lead to a lot of like food not being passed through the digestive system at the speed that it should be. And then the microbiome, which we've also talked a lot about, I think, on previous talks, can actually feed off of the food that's basically just sitting there waiting to be moved through. And that can actually cause a lot of fermentation, lead to a lot of bloating and gas because it's there for a longer period of time. Also, with that slower transit time, it can lead to an opening of a valve between your large intestine and small intestine. And so then bacteria from your large intestine can get into the small intestine. And I say bacteria, but can also be like yeast and fungus and other molecules of the microbiome and those organisms. But then they can back up into the small intestine, and then we can really have issues with food and digestion. And it's basically every time we eat, we can have the bloating or digestive symptoms or change in bowel habits, meaning diarrhea and constipation. One of the other big things actually with the migrating motor complex, if there ever is a history of food poisoning, it can actually damage that part of the digestion. And then I always can say, like, you might have, instead of it being like one nice wave-like action all the way through, you might have like a wave up here and then a wave at the bottom and then a wave in the middle. And so that can lead to a lot of more like incomplete bowel movements, or a lot of frequent bowel movements that are incomplete because it's not a one smooth wave-like action. So that's going to be a big part of that parasympathetic nervous system. The vagus nerve is that migrating motor complex, moving that through the system.
Yeah. Which, yeah, I'm happy you touched on too, like how the gut microbiome, or if you've had a food poisoning event where you've been exposed to some kind of bacteria, virus, parasite that shouldn't be in your gastrointestinal tract, going to affect that migrating motor complex, which then just is a snowball effect, right? We already had problems with the migrating motor complex, and now we've just added one more to it, and now we're not getting that smooth wave-like action through the entire digestive tract, which doesn't just present as constipation, right? You mentioned frequent bowel movements, not frequent bowel movements. These can all be affected by that migrating motor complex. So that's something we do. I think both of us focus a lot of our treatments on that area when we're treating the gut microbiome, to make sure that long-term that we are getting that sweep-like action. And there is research on different nutrients and medications that are indicated for that.
I'll just touch one more thing on that, just because you brought it up. So you mentioned constipation. So we talked about, again, like the digestive function and the enzymes not working. But if that vagal tone, or we are more in that fight or flight, typically it can be more like slow transit time, again, like having constipation or having a bowel movement, like it is, let's say, a vulnerable, thing that you're doing. And so if you are in a stress state, it can be really hard to have a bowel movement. And so a lot of the times when we do have, poor vagal tone, or we're in fight or flight, that can lead to a lot of issues with just transit time in and of itself, even if there's no issue with bloating and gas, or the migrating motor complex, or microbiome imbalances. It can just present as constipation or incomplete bowel movements, smaller bowel movements. So it can come out like that as well.
Absolutely. And then also kind of just touching on that as well, is that if we're not getting that proper digestive enzyme secretion, stomach acid production, bile production that helps break down all of our foods appropriately, because we're sitting in sympathetic nervous system, then we're not going to absorb our nutrients appropriately. And so then we have issues with energy levels, right? Because our energy pathways can't be properly stimulated by all the different cofactors necessary for that. Or we might present with hormonal imbalances, which is more kind of where I see that come into play a lot, is that if we don't have those proper cofactors being absorbed, your fats and your proteins that are so important for the making of your hormones, then we'll see that we get kind of further up the chain than just digestion alone. We'll see problems, right? Inflammation and ability to get out of that chronic inflammation, or working through those methylation pathways for proper energy production. Those can all be affected by our digestion alone, just because we're not absorbing our nutrients appropriately.
And because we're stressed.
Totally stressed.
Because that leads to that. And then this could be all the downstream. Totally. Totally.
Okay. One thing in terms of some other areas that we can look at that can help with nervous system regulation. As we were kind of preparing for this, we were talking about a few different things that can be helpful. Why don't we touch on light exposure to start? We both use this a lot in our practice, and what we mean by light exposure is not these fancy lights that we have overhead right now because we're in the dark otherwise, but more so the sunlight, and just how important getting outside and getting proper sun exposure is, not only for our energy levels throughout the day, but also for supporting that nervous system. So I'm curious how you explain light exposure. I've talked about it many times on these discussions, so people are probably sick of hearing me talk about it. But I'd love for Dr. Morrison to dive in there.
So I'll do a Cole's Notes version, then we'll get into it. So Cole's Notes, I always tell people, lots of light exposure, natural light exposure in the morning, lack of light at night. So definitely turning off lights. And so what that means is within an hour of waking, or now that we're becoming into winter and so it's dark, an hour of sunrise ideally. We're getting outside for 5 to 20 minutes every morning. No blue light blocking glasses, no sunglasses, like we're outside. You don't necessarily have to be directly in the sun, especially if it's like cloudy. This is still going to be beneficial. We still do want you to get outside, but very important to do that kind of first thing in the morning. And again, that light from the sun getting into our eyes, getting on our skin is going to help to trigger a 24-hour clock. And so a lot of the times when we talk about that 24-hour clock, people assume sleep-wake cycle, which is definitely a part of it, but it's not the whole story. So yeah, first morning light, sun exposure is going to be one of the best things that you can do for sleep, but it's also going to help. And when we're having breakfast, which we'll talk about too, get like the 24-hour cycle on for your digestive system and all of your digestive cells and your immune cells and your hormone cells. And we want all of these different systems to be lined up on that same 24-hour clock, because if your sleep-wake cycle is different than your digestive cycle, then yeah, we might not like have really great digestion at certain periods of the day, even though we're awake, or we don't have energy because our food's not being absorbed. And so we want them to all line up like that. That morning light exposure consistency is definitely going to be the best thing, at least that I think we both see move the needle for people. So, 30 minutes one day a week is not the same thing as 30 minutes total over the 7 days. So even if it's 5 minutes every day, that's going to be better for your health than that 30 minutes once a week. So consistency, as much time as you can get outside first thing in the morning, again, within an hour of waking or an hour in sunrise as we're coming into winter.
And we do specify like outside, not through a window. Unfortunately, as much as it might feel nice to have sun on your face through a window, you lose out on a lot of the spectrum of light. So you do have to go outside for us to get the benefits through this. Similarly, if you're like driving in your car, stand outside for 5 minutes before you go somewhere. Just give yourself that little bit of time in the morning, and you'll definitely reap the benefits the more consistent you are with it.
And even like, from a nervous system perspective, so actually that first light exposure in the morning from the sun actually provides your system with protection from all the blue light typically that we are exposed throughout the day. And so, even if you are having blue light blockers on your computer or glasses, and if say you look at a screen all day like we do, then the morning light exposure is actually going to help with prevention of that stimulation and kind of overtaxation of the nervous system that can happen for long hours that we're exposed to those throughout the day. So very important there. And then the opposite of that, again, that lack of light at night. So two big factors for this. One, I find most of the time a lot of people have heard of. So no phone an hour to 2 hours before bed, no TV, no computer, that sort of thing. That is gold standard. That is definitely the best practice. If like we have to be on them, then okay, having the filter on the screen is going to be best. Or the orange glasses typically are much better than the clear light glasses for that. So yeah, no screens before bed. And then the second part of that is any overhead light, again, an hour to 2 hours before bed should be off. Anything eye level or below is okay. So again, these lights that are on here shining into our eyes right now at this angle is going to let that 24-hour clock know that it's probably about noon. And so that can really help or disrupt, I should say, really disrupt that circadian rhythm. And so that can really help get that 24-hour clock back on cue and on rhythm like that. And so I find typically morning light exposure a bit harder for people to do, but definitely really key and potentially even a bit more important. And then that lack of light at night can really help to balance that.
I'll often, if my patients are able to as well, do middle of the day and evening sun exposure if possible. So in the middle of the day when the sun is right overhead, as these lights are, which is not ideal right now, but in the middle of the day when we're up trying to be productive and the light hits the bottom of your retina, that helps your brain and body understand it is the middle of the day. I'm supposed to be active, getting things done, right? And then end of day light, after we've had that middle of day light, helps our bodies understand time for me to wind down for the day. And then that's where that key reduction of overhead light exposure or artificial light, using lamps at home is totally fine. We just want them to be at that eye level, like you said, right? There is a great app if you do have to be on your computer at after the sun has set. It's called Flux, or F.LUX. I'll put it in the chat notes here in a second. But that helps just reduce your blue light exposure on your computer. It's not perfect, right? We are still going to get some blue light exposure. But if all of you could see my computer screen right now, it's a very orange hue currently because the sun has set now. And then during the day, it's more of a blue light when the sun is overhead. And that just follows the circadian rhythm of wherever you're, or sorry, I shouldn't say circadian rhythm, sun rhythm, wherever you are in the world. So it'll adjust based on your time zone, which can be helpful as we are all somewhat connected to technology.
Yeah. One of the things with the light exposure protocol that I want to I wish we could implement the smoke break without the smoke for everybody. Right. I feel like back in the day, it was kind of every hour you're popping outside, maybe going for a walk. And so if we could still do that and just not have the cigarettes a part of it, it would actually be very, very beneficial for everybody's health, for sure. Yeah.
And really key, I think in the summer, a lot of us do sun exposure protocols without even knowing that we're doing them. Really key to focus on those in the winter, right? Where we really see shifts in mood regulation and changes in nervous system regulation, right? When there's not as much sunlight out, it's not as warm, so we're more likely to be inside.
Yeah.
Right.
Yeah. I was just gonna say one of the things with that to take team. So because with the lack of light actually in the winter, cold exposure, which is probably the last thing people want to do in the winter, but it's probably one of the best things that you can do in the winter to help with that regulation, help with that nervous system. It really does improve mood. Cold exposure is kind of one of the only things so far that we know that will actually help to reset or serotonin and dopamine levels without causing the burnout or crash out after it. And so we can go to dopamine, but a lot of dopamine, everything really in our world now from a research perspective, social media perspective, they know that dopamine is going to be kind of what gets us hooked on things. And so when we are on social media or doing a lot of task switching and working away and our phone's buzzing or we got an email or somebody needs this and we're just kind of up and bopping around and doing a bunch of different things, it really can lead to that low dopamine or that dopamine burnout. And so that cold exposure can be one of a phenomenal thing actually in the winter to help reset dopamine and serotonin levels because we don't have as much sun. We might not be as exposed to, we're not spending as much time outside because it's cold. And typically with that cold exposure, for nervous system side of things, what we actually want to do is only do it to tolerance, meaning that we do want the body to be able to heat itself up afterwards. There are other reasons that you would do different types of cold water therapy, but if you're doing that cold plunge and say if it's 15 seconds or 30 seconds and you're getting out of the water and you're so cold and you can't warm up, of course you can bundle up and put clothes on. But if you're still cold an hour later, then that's going to be too much for that nervous system at this time. And then slowly over time, let's say if we got to go down, then if we did 30 seconds and we're too cold, okay, we'll go back to 15 and then we can do 20 and we'll do 25 and then 30. And slowly over time, your body will actually have that cold water adaptation that you can tolerate a little bit more cold water or that exposure, and that can really be beneficial for the neurotransmitters, especially in the winter because of the lack of light.
Another thing with just the dopamine and task switching, with that depletion in the dopamine in winter months, in summer months too, the more when we are at work or doing a task, finishing out that task before we're moving on to something else can be very, very helpful for your dopamine, rather than the constant switch to a million different things. I'm definitely guilty of it. It's so hard to not open up that notification when it comes through right on your Google chat or whatever it is, or the email that bings or dings. But the more that we can have kind of notifications off or time set out for email or replying to work discussions, and then having your meeting time be delegated to your meeting time and you're not looking at a million different things, that can be really, really helpful to essentially decrease the likelihood of moving into that dopamine crash, right? And then if we do need to replenish our dopamine, then looking at the cold exposure and light exposure, these are the things that keep that cup full, right? And then there's other things we can do to help reduce the depletion of that cup. Cool. With kind of next things to chat about, why don't we talk a little bit about like sleep regulation, going to bed at a similar hour, why that's beneficial for nervous system regulation.
Yes.
Because I do think that that's an important piece, right? If we go to bed at the same hour and wake up at the same hour, and then we get that proper light exposure in the morning, we are helping our nervous system in terms of that regulation throughout the day.
Yeah, perfect. So kind of back to that 24-hour cycle that we were chatting about.
Mm-hmm.
So our system actually does try to predict. So if you're always eating breakfast at 8 a.m.,
Mm-hmm.
your system will release the hormones needed to help with that blood sugar regulation at that time, because it's assuming that that's when you're going to eat. So same actually thing with sleep. So if ideally we're going to sleep at the same time, waking up at the same time every day, even on weekends, to help with that conditioning of that nervous system, so that it can help to predict when we are going to sleep, when it needs to release that melatonin, when we can get into those different types of stages of sleep with that. And so when we're all over the place, 9 p.m., 10 p.m., 1 a.m., then it's really hard to predict for our system and what time should those hormones be released, and then it can throw off that circadian rhythm. And when that circadian rhythm's thrown off again, when we potentially are maybe getting a second wind, right, at night, if you're used to going to bed at 8 and now we're staying out a bit later, okay, we can have that extra surge in cortisol or adrenaline that is going to keep us up later, but that will have some impact on our nervous system. And I mean, we're all going to do this here and there. We're going to stay out later, but if we are struggling with that nervous system dysregulation, or we are stuck more in fight or flight, it can be really beneficial to create that routine. And so making sure we're going to bed at that same time, and potentially other things to help with that. But, making sure that the room is dark, making sure that the house is a little bit colder than maybe typically during the day, to help with that initiation of that sleep, and our body temperature drops to help us get a little bit sleepy. And so if we can do these things to help condition actually our nervous system and have these steps, some people like to have a bath, some people like to drink tea, but something part of that routine, it can actually really help initiate that sleep cycle. And we're going to get up at the same time every day. Our system's going to know when we need to wake up, versus having that fluctuating range.
It's kind of interesting, right? It's kind of what we started talking about, where the limbic system knows, right? And then gets into these patterns, and we're now talking about the patterns that can help us maybe stay out. Sympathetic.
Yes.
So yeah, our bodies do like patterns. We obviously can't follow them every single day, but the more consistent we can be with things like this, the better.
Yeah, it can be very helpful.
Another thing with that is that can help with our nervous system regulation from more of a digestive standpoint. Dr. Morrison just touched on it a little bit in terms of having breakfast at 8 a.m. every day, right? Your body gets used to that. Another kind of thing to piggyback on that is avoiding skipping meals, right? Because when our blood sugar is well regulated, our nervous system tends to be calmer, right? Then if we've skipped a meal and now we're into a blood sugar roller coaster, that is more erratic for the nervous system to have to deal with, and will put us more in a sympathetic nervous system state. Sometimes that leads to those full-on hypoglycemia symptoms, where people might feel really shaky, or they feel lightheaded. Some people consider or can feel emotional shifts that they might call hangry. The more that we can avoid something like that, and making sure that we're getting 3 meals a day with adequate amounts of protein, healthy fats, and good complex carbohydrates, primarily consisting of vegetables and fruits, right? Those good fibers for the gut microbiome. That's beneficial, right? Too, in terms of just, again, that kind of regulation of all these factors that might be affecting the nervous system. More so from the digestive standpoint, affecting blood sugar regulation, which could affect our nervous system. Yeah. Cool.
Yeah.
Anything more to say on that?
I don't think so.
Okay.
Not from digestion. I think we got it. Yeah.
Why don't we talk? We talked a little bit about the gut microbiome, right, and how it can affect that migrating motor complex. Why don't we talk a little bit about the neurotransmitters that are produced in the gut, how the nervous system might be affecting some of those?
Totally. Yeah. So part of our microbiome, or one of its major roles is actually to produce serotonin in the gut. I think there's they're coming out with new research all the time about serotonin.
Yeah.
And so
what is serotonin? Why don't we actually say that too?
Like that it's a neurotransmitter?
Well, yeah, it's a neurotransmitter. So, I mean, I'd sometimes consider neurotransmitters to be hormones of the brain, right? So they have binding receptors in the brain, but serotonin is more of our kind of content neurotransmitter, right? We feel happy and content. Dopamine is more of that kind of like motivation and happiness, right? So with serotonin, it's more of that kind of content feeling that we get, which can really help with mood regulation day to day.
Totally. Yeah. And so, if there's a like dysbiosis, just meaning imbalanced bacteria that is in the gut, and we're not producing enough serotonin, and that communication through the vagus nerve from our gut to our brain about that production of serotonin, it can really impact mood. It can lead to anxiety. We see that at time. Other imbalances directly related or indirectly, but a lot of brain fog, depression, difficulty concentrating, kind of poor memory can all come from an imbalance in the gut or any of that inflammation that can be triggered by an imbalanced microbiome. And so usually, when we're looking at not just digestive symptoms, again, that's common with like bloating, gas, change in bowel habits, but also taking into consideration this other side of things with mental health, with emotional health. Okay, is this all part of the full picture? Do you think it could be stemming from the gut or vice versa or both? But then we're typically looking at that microbiome. We can do some testing to look at that, but then we really do want to focus on rebalancing that microbiome, whether that be through nutritional side of things, like fiber fermented foods, kind of rebalancing the bacteria that's in there, or if we're using some sort of supplement, typically an antimicrobial, to rebalance that microbiome. But once we do rebalance that microbiome, get it back to functioning, getting it back to having a lot of diversity of the different species in the gut, you can actually rebalance those serotonin levels and get that communication back to the brain to help with mood stabilization, be a bit more calm, have less anxiety. So it can be a really important factor for impacts there. The other kind of link to this too with that microbiome imbalance, and there are, like, your neurotransmitters are off, there's inflammation in the gut, that is going to be a stress response to the body, and so then that will also shift your system back more into that fight or flight. We actually do release more cortisol in the system when these things are imbalanced, and so just even that can be something that's going to trigger your nervous system kind of directly through the hormonal cascade as well. And then again, that stress feeds right back into that digestive disruption. You're not breaking down your foods as well. Proteins from foods are getting into your bloodstream through those tight junctions that shouldn't be there. And so it can kind of be like a chicken and an egg in a way. What came first, and which one do we have to start with or treat? And typically, focusing one can really help balance the other, which is helpful.
And I mean, often we'll treat these things simultaneously so that we're treating the nervous system with neurofeedback potentially, and then we're also treating the gut microbiome at the same time to make sure that we're attacking it from all angles, right? And then if there's hormonal imbalances or chronic inflammation, then we're going to be looking at those areas as well, as to, are those actually triggering some of these symptoms or triggering the nervous system dysregulation, right? One thing with that too, that we can help just to regulate nervous system so that we're in more of that rest and digest when we go to eat, is not only having kind of like 3 more structured meals a day, but actually sitting down to eat your meal, ideally away from screens, and taking even 5 deep belly breaths before you eat. That is going to help with digestive enzyme secretion. You'll actually notice that your saliva production increases, which has key enzymes that break down some of your carbohydrates and helps to lubricate your food before you mechanically chew it or while you're mechanically chewing it. And then once you swallow, that digestive enzyme secretion that has happened from your pancreas, which will go into your stomach acid secretion itself, and then your bile production from your liver and gallbladder will help you actually break down your food appropriately. I usually walk patients through kind of the 3 phases of digestion when I talk about this. And the first one is cephalic. So that's brain communicating with the digestive system to get the proper secretion of digestive enzymes. If we take that kind of 5 to 10 minutes before we eat, if we actually sit and have our meal, we're going to get more of that cephalic phase of digestion. If you cook your meal ahead of time, you're getting way more time for that cephalic phase. Step 2 is mechanical, so the actual chewing of our food. We don't want to just be shoveling food into our mouths, which in the kind of go, hustle bustle of life can be something we just get into a routine of, right? So we want to actually take the time to chew our food. And then that third phase is what's called chemical digestion. And that's where all these digestive enzymes, stomach acid, bile, are actually breaking down your food in your gastrointestinal tract into the small pieces that are then absorbed through the gastrointestinal tract to the bloodstream. So without that first phase of digestion, we significantly impact the chemical phase of digestion, right? And so the more that we can kind of take time to eat, not wolfing down our food, and then also giving ourselves a bit of time beforehand, that can really, really help with your overall digestive system, help you get into that parasympathetic rest and digest system before eating, just so that we have the best opportunity to absorb the good things we're eating, and those micronutrients that we need for all of our bodily processes.
Yeah, the breathing I find huge.
Totally
Difference. Like, even if you're running around and even if you're having a busy day and, you know, maybe all of these pieces just today aren't working. We got lots to do, but just having your meal, taking 5 deep breaths, exhale longer than the inhale can make a huge difference for people. And if you can, similar to like afterwards, still taking some time instead of like having the last bite as you're getting out the door, like getting in the car, you know, plan some time for afterwards to rest and digest and just be, or like going for a walk or something that's a bit lower intensity than just jumping right back into things can be helpful for that too. But yeah,
I mean, all of our moms didn't let us go swimming right after eating, right, when we were kids, and there's definitely a reason for that, because it really, really helps with your digestion. Cool. Do we have anything else to touch on that you wanted to talk about?
Let's see. I mean, there's so many nuances that we can go into, but I think that, kind of the big takeaways is that, you know, really, really helping to support that parasympathetic state to help with mental, emotional, whether that be through the microbiome, whether that be through the neurotransmitters. If we are stuck in that fight or flight, you know, let's dive into that, see why that's like part of the nervous system state that it wants to be in. What can we take out of your cup to help you switch back into that parasympathetic side of things? Is there anything else physically that is also part of that? So of course, we talk about fight or flight and stress, but really whenever I use that term stress, it's like a lot of people think it's like, is my life stressful? Like, is there something going on at work? Did something happen in the family? But really, I also use that term stress of like, is our blood sugar regulation not great? Is our microbiome imbalanced? Is our hormones off? Like all of these other things, I also consider that to be stress on the system. And so what are those levels of stress, mental, emotional, physical, spiritual, whatever that is? What can we go through with that to help take out of your cup so that it's easier, or it's a bit more, easier or faster to get into that parasympathetic state so that we can actually help the nervous system and digestion. So looking at kind of as like a full picture like that, it's, there's lots of different places that we can go, but it is one of those things that will impact your entire system. Physically, again, your entire life, if you're in that fight or flight, it just, things don't heal the way that they should. So it's a big topic that's very interesting. But
Totally.
Definitely lots that we can do.
Yeah, for sure. And I think that's a big kind of piece of what we do, right? Is trying to, in our initial visits, we take 90 minutes with patients to go through a comprehensive intake to understand, okay, what are the stressors on the system right now, right? And are there hormonal imbalances, digestive, our gut microbiome, dysregulation, blood sugar, mental, emotional, how is mood regulation, how is stress, right? We always ask that question too. How is sleep being affected? Do you exercise regularly? These things all help give us clues, right, in terms of what might actually be affecting that nervous system and what needs to be treated moving forward. Gut microbiome is probably one of the top things that we both treat, but there's many other categories that we look at within this to really understand for each individual patient what needs to be looked at and treated appropriately.
Yeah. And the brain maps that we do, we kind of touched on that a little bit earlier, but and the heart rate variability is part of that test. The other big ones that are a part of that, there is it's something called a Loretta, but it's basically how deep and where in the brain are certain regions upregulated and downregulated. And that on there is like the hippocampus and amygdala that are part of that limbic brain. And so we can see if that limbic brain is living out a memory or it is kind of stuck in a memory or processing a memory. And so we can see that and see kind of what regions of the brain that it's hijacking to also be in that survival mode. And so we can go, okay, this is also, we're seeing this upregulated. This is something we got to look at. And then that information, of course, our brain is going to know what's happening in our entire body because it's sending signals to and receiving signals from. But that can also tell us about infection, can also tell us about hormone imbalances, if there's any inflammation in the system. And then we can see different patterns on there, especially more from like a mental health side of things. You know, if someone is having more anxiety or depression or ADHD-like symptoms. Okay, what patterns are we seeing in the brain that might also be a cause of this, and where might those come from? Let's say like a concussion. And so we can actually narrow down and look more into a really in-depth version of that brain or part of that central nervous system, which is going to impact the peripheral nervous system. And then we can actually have, again, with our clinic, we do neurofeedback, but a treatment option to help integrate, to help rebalance, to help kind of guide how to process that information or help to shift that system back into rest and digest. So lots of different options from a physical perspective, and then a brain perspective, actually looking at the brain and looking at the nervous system and the function and seeing how it's performing.
And then it's something we can track over time, right? With if patients undergo neurofeedback, and we're working on helping to support that the brain's ability to handle those different stressors, right? Or processing through the different triggers for that limbic system activation, right? Then we can track the progress by seeing what we call a pre and post brain map, right? Where we can understand, okay, based on the last treatment protocol, did we actually see a shift here? Plus, how are the symptoms, so that we make sure we're tracking and getting progress within that too. And
it helps for us to guide and change that neurofeedback protocol. So your anxiety pattern might be different than my anxiety pattern. And so then our protocols for our neurofeedback might be absolutely completely different, even let's say if our symptoms were showing up very similar to each other. And so, having that information and kind of those remaps really can help guide and make us very specific of treating what we're treating there. But it is, I always find the brain map so cool to see and see how they change and see how people feel correlated to them. So
for sure.
It's pretty cool.
Yeah, really cool. If anyone has questions, or if anything has come up that you'd like to ask us, you're welcome to pop a question in the chat. Everyone should have access to that chat. It's on the right-hand side on the lower kind of bar of different things. So if anybody has a question, we'd love to answer some questions. If there are some, I'll pop this Flux app in here for you guys if you'd like to download that. We'll wait a couple minutes to see if there's any questions, and if not, we may dive into another piece of
see what happens.
Nervous system. But don't be shy. We'd love to answer any questions.
Or any other questions.
Or any other questions. It doesn't have to be about the nervous system.
We will do our best.
Okay. Well, I don't see any questions coming through. So why don't we talk about some other stuff?
I was going to say, I don't know if you want to chat about kind of how you see it with hormones on that side of things. Like if you want to get more into that, if not, that's fine too.
So I treat a lot of hormones within the women's health, but hormones are not just women's hormones, right? So estrogen and progesterone are, of course, the two hormones that fluctuate in the menstrual cycle. And sometimes we do see changes in nervous system regulation through the menstrual cycle, right? And so that often happens about a week out from a menstrual cycle occurring in the quote unquote premenstrual symptoms or PMS symptoms that women might experience, where mood regulation is suddenly not there, right? So sometimes women will experience more anxiety, some women will experience more depression, some women experience anger tendencies around that time. And that can be an imbalance in the hormone fluctuation that is then essentially filling that cup of your nervous system where things start to boil over and we get symptoms, right? So that'll be a key thing I'll assess for if that's occurring.
Yeah.
If it's very specific to the menstrual cycle. Another hormone I often assess with more fight or flight is cortisol, right? We didn't really touch a ton on cortisol tonight because there were so many other things to talk about, but cortisol is our main stress hormone. It does govern our circadian rhythm. So it's very governed by sun exposure, right? And so light exposure protocols are foundational for treating cortisol or stress hormone dysregulation. But often, at first, when we're exposed to high stress in our environment, we're going to have high output of cortisol, right? And if that turns into more of a chronic high stress input, our bodies won't go back to baseline. Well, actually, our brains will stay, oh my gosh, I can't handle this much pace for this often. I'm actually going to shut this down. So then we see a low amount of cortisol production. And often with the low amount of cortisol secretion, we still feel stress, but our resiliency to stress has changed. And so our ability to adapt to changes day to day, like if something random comes up and throws your day off, can't handle that. We're not ready or prepared for that. It's like we don't have that resiliency in the stress system. And that's often from a lower cortisol output. Energy levels can often be affected too. Circadian rhythm in terms of sleep regulation is often affected at that point. And so this is something that we can assess for in testing by understanding how the cortisol is rising and falling throughout the day. And is it properly rising in the morning and then slowly petering out throughout the day, nice and low at night so that we can fall asleep? When we see that low production, there's certain treatments and herbs and nutrients that we might think about, right, in terms of supplementation. But we've actually already talked today about two key things that I incorporate with this for more of a chronic stress picture. One is 20 grams of protein with breakfast in the morning before 10 a.m. Okay. And the second is getting morning sun exposure, at least 5 minutes. If you can be out there for longer, awesome. More sun, the better. But 5 minutes outside first thing in the morning. And that helps just retrain that circadian rhythm and helps with essentially that resiliency to different stressors. I think we had a question come through. How does autoimmune items like skin conditions relate to this? That's a great question.
Okay.
Do you want to answer that?
Okay. Well, we can do that first one.
Sure. Why don't we do the first one and then we'll do that one after.
So yeah, I mean, with autoimmune conditions, typically there is going to be a trigger, of course, where the immune system thinks that some part of our body is actually a foreign invader, and so it's going to mount that attack on the tissues. So in this case, if it is the skin condition that is the outcome of that autoimmune reaction, or our immune system kind of attacking our own cells, then that would be how it presents with you. With the autoimmune side of things, or really whenever we are more in that sympathetic dominant state, that fight or flight state, typically, again, that release in cortisol that can follow that is going to cause an aggravation of all autoimmune conditions. I guess it actually doesn't matter what kind of condition it is, but we're going to have that upregulation or response to that stress. And then that symptoms correlated with that condition are typically going to be elevated. We also need, from that nervous system side of things, in order for our body to heal from anything, to be in that rest and digest state. So if we're always in that sympathetic or that fight or flight side of things, we're not actually really giving our immune system time to rest and recover and recuperate all of those resources. It's just going to continue, I'm going to say, to kind of like be on fire and do its best that it can do in that state. It's never going to actually be able to recover and recuperate. So from autoimmune, or really any type of health condition, we really want that primary or that dominant state to be rest and digest, parasympathetic state, and then we drop again into that fight or flight when we need to, and we drop back. Where if we're more in that chronic fight or flight state. It's going to be really hard to get out of or get into remission, like of flares or the condition kind of for a longer period of time, because that immune system is always going to have kind of, it's almost like your limbic system, but that upregulation, it's going to always be on alert of what's coming in here, because it's going to be in that more aggravated state or heightened state there. So it's going to, I mean, it's definitely going to impact it a lot. And a lot of people will come in with autoimmune conditions and be like, okay, yes, I have this condition, but it's so much worse when XYZ stressor is a part of the life, or this something happened at work or something happened, and then they'll get this flare, and it is because of that underlying mechanism behind it.
Or a key reason that it even comes out in the first place, right, is some stressful event, whether that's an illness, something stressful at work or in your personal life, that then triggers that, right?
Yes.
And then the cascade of the immune system imbalance occurs.
Yeah.
Okay, let's do this last question here. I found the mentioning of finding out why the nervous system does certain things that aren't good for us is something that I like to be able to remove. Let's say I know why, and how do you help it be on your side over against you? Is that something neurofeedback helps, or to be explored with a counselor? Great question. I'd say both.
Yeah, both. I was gonna, and they kind of do different things. So let me just read this again. Yeah. So, I mean, yeah, everyone's gonna, I'm going to say, kind of respond to treatment a little bit differently, but the way I would differentiate between a counselor versus neurofeedback, and totally beautiful together, so this is great, but with a counselor, usually right off the bat, you're going to be talking about things that are in your conscious awareness. So that, like, if I read this correctly, like, you might be doing something and you know why you're doing that something, but you don't want to do that anymore. And so we can kind of use that talk therapy and get to the root of, you know, what might be driving that, and that can be super helpful. And they can give you tools of, okay, when this happens, we do X, Y, Z, and beautiful. And then there's neurofeedback, which is actually going to be in the brain mapping that we do, is focused on the subconscious. So what that means is, with our conscious brain, typically that's about 5% of our brain. That's going to be what's in our awareness. And then the other 95% of our patterns that we're going through the motions day to day over and over and over again that we're not aware of. Again, we're not going to be worried about, we're not aware that we're digesting our food. We're not aware of our breathing rate. We're not aware of our heart rate. So all of these other patterns that were happening every day, those are going to be part of the subconscious side of things. But that subconscious side of things it's not only physical, that's also going to be mental and emotional. And so when something happens to us, we're going to initially have a trigger, which is going to be that subconscious side of things. And so that's going to be what we're looking at with neurofeedback. And what I mean by that is, okay, something happens, you scare me, and I go, oh my gosh, and that's going to be my initial reaction. And then maybe in 5 seconds, I go, oh no, that's Dr. Smith. I don't need to be scared about this. Okay, we can go about our day. But in that 5 seconds that I was worried about this, I already released all my adrenaline and my full body had that response. And so then it's like, okay, now we got to talk myself out of that. No, I'm okay. I'm safe here. And so what we do with the neurofeedback is, what we want to actually do is train that subconscious side of things to be like, okay, when she scares me, I don't have that adrenaline rush. Okay, I don't have to kind of talk myself out of it. We're going to fire this pathway, this new pathway that we're creating, so we don't have that initial reaction. And it's usually that initial reaction that's going to be what keeps us stuck in the fight or flight. And then we take a lot of energy to transition out of that back into rest and digest. So when there's these subconscious patterns every day, whatever that is, that really any of the narratives that we have in our mind that are kind of running in the background, what we want to do is transition those out, either bring them into the awareness so that we can chat about it, or transition them so that they're not firing those, like, without basically our awareness. So yeah, both, and like one and or both. But yeah, counselor is going to be more of like the conscious side of things. Neurofeedback is going to be more of the subconscious, and they do pair really well together in the sense of like, okay, we're going through, or we're experiencing, or we're having this emotion and sensation with neurofeedback. Okay, now we can chat about it. Where is this coming from? What's like that? And vice versa. Okay, we're maybe doing counseling and we're stuck on this point and we can't move past it. There are some certain things like cerebellum hypocoherence or certain communication pathways that we see in the brain that actually won't allow for the full integration of what we're working with our counselor with talk therapy. So they're very complementary. They kind of do treat different things. And so, yeah, both can be useful. Yeah, it's kind of where you're at in your journey, really.
Totally.
If that makes sense.
For sure.
Okay.
Yeah. Cool. Well, that's all the questions. And it's 8 o'clock. So, it helps to calm the subconscious then to not trigger anxiety.
Yes. So, so what the neurofeedback is going to do is it's going to, not trigger the anxiety. So whatever is causing the anxiety, the neurofeedback is going to help integrate that information. So usually, again, something happened, it overwhelmed our nervous system. And then now when we move forward with that information in our limbic system, it's going to try and predict that future. And then we can get anxious. So at this point in my life, years ago, I felt unsafe in XYZ situation. Again, this could be totally subconscious and not really in our awareness. But now when I show up in this situation before I play a game or whatever, now I have more anxiety. Okay, what we're going to do with that neurofeedback is help to train the subconscious to allow that information or that memory to be processed so that we're not living out of that memory. So, going through neurofeedback, I wouldn't say that it would trigger more anxiety. Some people can have more anxiety, but it's not the goal of treatment with that. Some people can feel more angry. Some people can feel more happy. They can sleep more, have more energy, have less energy. And so all of these things, basically emotions can rise to the surface. But when they're rising to the surface, that's actually going to mean that we're integrating that emotion that needs to be integrated. And kind of with all the counseling work, we have to feel those emotions in order to be able to process them. Where if emotions coming up and we go, yeah, no thanks, not today, then it will come back stronger the next time that it comes back up. So it's basically creating that space or in that container, that cup, we're making it bigger so that emotion that's coming up, you have more space to actually be able to feel it, and then we can process it and integrate it. So then when you move forward, it's not kind of always looking in the back of your mind.
Yeah. Awesome. Yes, this was recorded, Florence. The recording will be sent out once this webinar is complete. And that should come to you fairly soon. Since you signed up for the webinar, you should get an email with this recording right away. Awesome. Well, thank you guys so much to everyone who came out to the webinar, for your great questions and for your attentiveness. And we look forward to potentially seeing you guys in clinic. We're here at Nirvana Naturopathic Medicine, and have a great evening. Take care.
Thanks, everyone.